nowadays people terms it as a medical tourism and I say it as a dental tourism. There's this exclusive thing called TMJ. Now in India, TMJ joint treatment is it's less or ignored field is what I say. Our dentists or Indian dentists are far better in performing those treatments than even the Western. So whenever a celebrity patient comes to you, definitely will be under pressure. Controlling and doing that is very important, and we tend to give a overcare. I think that we should reduce it, and any patient we should focus in such a way we are doing only for a regular patient. Certain things newcomers should also think. Dentistry is definitely is an excellent field, and putting a clinic is definitely a great idea, not just an idea where whether you click or not.
We do multiple procedures in dentistry. So coming to the medication part, so is it necessary to give all the antibiotics, or is antibiotics itself is required for all the procedures? Because you have already done a small research about the antibiotics.
What I'm seeing the new generation, when any patient comes to their practice, if they have even a minimal, forget about the swellings. If patient complains of pain, first thing they write is antibiotic. So bombarding patient with antibiotic is not at all a good thing. This attitude should change. Only in need, a necessity that need only to be prescribed. Otherwise, it should not subject patient to antibiotic and do not cause any abuse. I think this is my key point which I wanted to tell the newcomers. Only it required and specific, and also when you're prescribing you should know whether it is a gram positive or a gram negative, aerobic or anaerobic. So related, you have to analyze what is suited and give only that. Instead, don't subject all whatever it full coverage should not be done, which will give a negative effect or it becomes an abuse.
So you have treated various celebrities from all different fields, be it sports, politician or IT, any field. And how was your experience? So because I have done a procedure and it was my prosthodontist. So what happened was we tend to be extra careful and extra cautious. So in the end, what I did was just to make it more nice for the X-rays and all, I wanted to introduce my last rotary file and I broke it. And is there any extra pressure, or how do you handle, sir? How was your first celebrity experience, sir?
See, yes, obviously your point is right. So whenever a celebrity patient comes to you, definitely will be under pressure. Controlling and doing that is very important, and we tend to give a overcare. Okay? I think that we should reduce it, and any patient we should focus in such a way we are doing only for a regular patient. Yes, it is easy to say, but while treating you definitely have has standing. That definitely I agree. But luckily, I didn't had any mishaps while treating any of the celebrities.
So as a dental practitioner, we get a lot of patients from our friend circle, relatives, family members, or even from our particular area. But for you, sir, patients come from throughout the world and they're so happy, they're so satisfied, and they go back. So how is that possible, sir?
It's not the famous, it is nowadays people terms it as a medical tourism and I say it as a dental tourism, where if you do a good work and if it goes beyond the sea or beyond borders, so obviously patients search for you and they come across wherever they are, they'll come back here. And since especially I'm doing exclusive implantology, so if they need any full mouth or implant rehabilitation, which is an expensive affair in abroad, so they come here, so they finish the tourism as well as the dental thing.
So, as a dentist, it's our dream to open a clinic. And I see some of the dentists, they invest a lot of money and they passionately open the clinic with a lot of enthusiasm. They open the clinic, and then after a few months or years, they get so frustrated, annoyed, and then they hate dentistry so much they want to quit dentistry completely after years of struggle. And what message you want to give them, sir?
There are certain things newcomers should also think. Dentistry is definitely is an excellent field, and putting a clinic is definitely a great idea, not just an idea where whether you click or not. If you have a passion, you have the work, definitely you can click. Now, everybody thinks within the city or wherever you're staying nearby itself. So that is one mistake. So whenever any dentist who wish to put a new clinic, selection of a place is very important. That's number one point. Number two, after putting, even when you're planning to put a clinic, you should also see what all the things you gained. Are you ready to start a clinic? Because a clinic is not a thing what you only know, which you have to manage the dental problems rather than just what you know. So once you are fully trained, so you should have trained under someone, then acquire the knowledge, then only you should start the practice. That's number one. Another thing is when you start a practice, you should not think that you put a practice and people will start coming after seeing your board. You have to do your bit. See, whenever any shop or any clinic or any hospital opens, you should do your bit to attract or gain the attention of the patients. And once patients come in, then you have to prove with your work, and then with the word of mouth, obviously you will get the patients. So never discourage if your clinic is not running well. Plan it in such a way where it is going wrong, correct those issues, and obviously a clinic clicks.
There are so many dentists in the market. There are so many clinics. It's almost like saturated. Everywhere you see it's clinics. Any cross you see, they're like adjacent clinics. So do you think a clinic is the only source where a dentist can earn their income, or is there any other source of income?
In spite of having so many clinics, you see, everybody are happy, or at least most of them are happy in their level. But at the same time, a newcomer who is wished to start a practice should also think you should go out of the box. Don't just plan for just like you finished it, so your early aim is of putting a clinic. No. So I know there are people, juniors who just started their practice, and now their practice is more than a dentistry. They are fully into other cosmetic procedures, hair transplants. Okay. And not only that, it's a simple example. Once you come out, don't think that you have only the clinic. There's this exclusive thing called TMJ. Now in India, a TMJ, a joint treatment is it's less or ignored field is what I say. You can start acquire a knowledge, go abroad, get trained in that, come back, start an exclusive TMJ center. It's not I'm telling them new. There are people who did this and achieved a higher level now. So instead of dental clinic, start the TMJ center, start the cosmetic center. So anything you go deviate from the straightforward route and you're going to click in that field.
There are many advanced things which has come up in the market. So your take on modern dental practice, sir?
Dentistry is advanced so much that we are not just on par with the Western, we are even, you can say, ahead. So whatever the technology is there in the West is absolutely there, and in fact our dentists or Indian dentists are far better in performing those treatments than even the Western. And that is one reason the patients from West come for dental treatment in search of dental treatment. They come here. It is not only a factor of the price, it also the quality. I think the future in dentistry is such a forward, it is happening. Soon you don't even, a dentist has to sit and the robot will just perform whatever the treatment. That even it is already have come, even while doing implants. Now the advanced techniques what we are doing, you don't need to even bother about how much is a bone, how to drill, or whether you have to open the gums or not. Such a technology has come which is called even robotics or navigation technology. So where you can just blindly see the screen, you can perform the dental implants. So I say we are much advanced or on par with the West.
So many years of practice, and still you have to practice further. But do you think there is a end mark or a retirement age? So any plans of that? Have you planned for retirement, or how is it?
Yes, definitely I have already planned my retirement. Only I can say another 10-15 years only I'm gonna work, and I will stop probably, enough of whatever the struggle. I want to go back to a native and just take care of farming or something, but I will definitely stop dentistry after that.
So it was such a pleasure to know more things, and definitely, including me, most of us are inspired by your story, sir. And I really thank you from the bottom of my heart. And yes, this message is truly priceless. So finally, any message for our viewers?
Yes, indeed, it's my pleasure to have a nice chat with you, and I hope my story inspires few people. Now, for a person who just finished, what my message is, don't lose hope. Even myself, even I was at one point of the time, even I wanted to leave dentistry. So my message for your viewers, especially who are budding and wanted to start their practice, or who are just finishing their career, dentistry is not just one line where you do BDS or you do MDS afterwards and you start practicing, or go for a consultations or a clinic. There are various ways. Go out of the box. Now it is, people say the same word, it is saturated. Yes, I do agree at one level, it is saturated within the cities, but still you have a lot of scope. Go out of the box, don't just follow the straightforward. Think differently, and definitely you create wonders and you become a great person.